Urinalysis has sometimes been called the needleless biopsy. A little bit of urine can tell a lot about a patient's health. Normal urine should have a pH between 4.5 and 8.0. The average is usually about 6.0. It's just slightly acidic. The specific gravity should be 1.001 to 1.035. Pure water has a specific gravity of 1.000. Urine should have some things dissolved in it that make it a little more dense than water, even very dilute urine. Urine should be clear. It's straw to amber in color. This is because of the pigment urochrome. The things we expect to find dissolved in urine are urea, sulfate, creatinine, uric acid. These are the things we're trying to get rid of. These are the nitrogenous waste products. There'll be sodium, phosphate, potassium, and other ions. These levels will vary depending upon dietary intake. To check specific gravity, we use something called a refractometer. Specific gravity can be used in diagnosing Addison's disease, dehydration, glucosuria, diabetes insipidus, and kidney failure. In order to do the test, you place a drop of urine on the test area and then replace the cover. You then look through the eyepiece. When you look through the eyepiece, you see three scales. You want to read the scale labeled UG. This particular reading is 1.000. This is consistent with pure water. This is a rather dilute urine. Here you can see the 1.000 reading. Then it's 1.005, 1.010, 15, 20, and so on. So you have to kind of estimate. This is somewhere between the 0.5 and the 0.10. So it's a little closer to the 1.010. We'll call it 1.008. It's an estimate. This would be a very dilute urine. The other part of a urinalysis is using the dipstick test. This is simply a plastic stick that has several pieces of filter paper on it. Each piece of filter paper contains chemicals that can test for various constituents in urine. You simply dip the stick in urine. You just want to dip it in, pull it out, shake the urine off a little bit, and then wait the indicated time for each test. That will be listed on the side of the can. You then compare the squares to the colors on the can and read according to the colors that you see. Things we do not want to see in urine, things that are considered abnormal, would be things like glucose. This is called glycosuria. We see this in diabetes. High ketones would be ketonuria. This is seen whenever people are using fats as their major energy source. So diabetics will have ketones in their urine, as will people who are on starvation diets or who are starving. High proteins is known as proteinuria. Hypertension can cause this, as well as damage to the glomerular filtration device. If this device is damaged, then protein can leave the blood and get into the urine. Red blood cells in the urine is called hematuria. This may be an indication of renal calculi, which are scraping along in the ureter and causing damage. Infection can cause RBCs to be in the urine, and trauma to the lower back. Hemoglobin in the urine means that red blood cells have been in the urine long enough to lyse. This usually means that the lysis is occurring rather high up in the urinary system or even in the blood itself. Transfusion reactions, hemolytic anemia, and burns will cause lysis of red blood cells in the blood vessels, and only the hemoglobin will be eliminated in the urine. White blood cells in the urine is known as pyuria. We see this whenever there's some sort of inflammation, like a urinary tract infection. And bilirubin is a very yellow substance that may be seen in the urine. This is an abnormal pigment in the urine. It's known as bilirubinuria. This indicates liver damage, hepatitis, cirrhosis, or some other liver disorder.